Perfect. And again, good evening, everyone. My name is Michelle Avila, and I am the chair of the Health and Human Services Committee. This is our monthly meeting. I am going to pull up the agenda shortly on my screen, but I wanted to read our meeting guidelines. So on September 2nd, 2021, Governor Kathy Hochul signed into law Chapter 417 of the laws of 2021, which authorizes the community board to run this meeting remotely, and minutes will be taken for record keeping. The minutes will appear on the website within days and can be requested from the Bronx Community Board 7 staff at any time. If you're calling into the meeting on a conference line, the controls are as follows. To hear all available commands, you enter ** on your phone, *6 mutes and unmutes you, and *9 virtually raises your hand. The meeting will be conducted as follows. Bronx Community Board, before I go into how the meeting will be conducted, wanted to remind folks that Bronx Community Board 7 has the right to remove or ask a member of the public to leave a meeting or block participation of anyone who engages in inappropriate conduct, including but not limited to obscene or offensive images or language, personal attacks, threats, or any other behavior that reasonably impedes the orderly administration of the meeting. Repeated offenses will be reviewed by the board's executive committee or any other assigned committee for a ban. The amount of time to be objectively determined by the above committee of the participant in the event of repeated disruptive behavior. If in-person outbursts or attacks continue, this will be considered disturbing the peace and the authorities shall be summoned. And the meeting will be conducted as follows. Everyone besides the speaker or presenter will stay muted throughout the meeting. After each presentation is over, I will inquire if committee members have questions. Committee members will signify that they have questions by pressing the raise hand function on the Zoom screen or requesting to speak through the chat or when the chair opens the floor by unmuting themselves. Members of the public who have joined through the online link will be able to ask questions and make brief statements on the item after each presentation and after the committee has had an opportunity to ask any clarifying questions, also by pressing the raise hand button on the screen or requesting to speak through the chat or when the chair opens the floor. Only those recognized by the chair of the committee will be allowed to speak during the allotted time. We will stay on topic with the agenda items. Any other items will be acknowledged by the chair in new business or addressed at the next meeting, granted that there is time and the committee agrees on the topic. Following the question, discussion, and public comment portion, the committee will begin their discussions after each presentation or agenda item and will conclude with the decision to vote on a recommendation if warranted. When the agenda is finished, the meeting will be adjourned. If there are any questions related to the meeting software or to our process, please use the raise hand function or contact our Bronx Community Board 7 staff. So thank you all for joining us tonight. We appreciate everyone's flexibility. We usually meet the third Tuesday of every month and moved up our meeting in order to be able to conduct this meeting remotely, taking into consideration the rising COVID rates in our communities and also just general accessibility, wanting to ensure that this is recorded and that we are able to share this with members of the public who may not be able to attend right now, but then can view the recording. I'm going to take attendance really quickly. And so I will ask committee members present to please unmute yourselves and let me know that you're present. And so I'll start with Alfred Grant. Alfred Grant. Michelle Gonzalez. Michelle Gonzalez. Helene Wilson. Helene Wilson. Emmanuel Asamoah. Emmanuel Asamoah. Daisy Perry.
Daisy Perry, present.
Thank you, Daisy. Chad Royer is not at this meeting.
I actually am.
Oh, hey, Chad.
Yes,
Thanks
hi.
for attending.
Thank you. Next week is when things get cloudy, but I'm here. But I have to
Awesome.
get off. I have to get off at 7:05 though.
Okay, awesome. Attendance noted. Thank you so much for making it. I know this is a busy time for folks.
Thank you.
Thank you. All right, so we will get our meeting started officially. I'm going to pull up the agenda on the screen. So tonight we have a few presentations on deck. We're going to have a presentation from the New York State Department of Health on navigating the marketplace for health insurance. We are also going to have a presentation from the New York City Department of Social Services, the Office of Citywide Health Insurance Access. And then we're also going to talk about our fiscal year 2023 statement of needs and budget requests, and just get a jump start on that this month, and hopefully have it on folks' mind for the summer, so that we can kick into full gear in the fall when we resume our board meetings. We will also allow time for representatives of city agencies and our hospitals to give updates. I want to talk a little bit about the community health needs assessment, which is right now live and will be concluding at the end of June. And then we will see if anyone has any potential topics that they want to discuss in the fall. So that is our agenda for tonight. I'm going to stop sharing now and ask if Stana Nakil from the regional director from the New York State Health Marketplace is on the line. Do we have?
I will actually, she's a former colleague of mine, so I'm going to give her a call.
Thank you so much, Audrey. Thank you. Thank you. While that happens, I know that Dawn is on the line, and Dawn is the outreach coordinator for the Office of External Affairs and Citywide Health Insurance Access Office. And so, Dawn, if you wanted to start your presentation, we could absolutely start there, and then see if Stana can join us afterwards.
Absolutely. Can I share screen?
Yes, 1 second. There you go. You should be able to.
Okay. Good evening, everybody. Can you see my screen?
Yes.
Okay. Let's go back. As was said, my name is Dawn Shuck. I want to make sure can everybody hear me clearly, because there was some issues before.
We can hear you, Dawn.
Okay.
Yes.
I'm the outreach coordinator for the Office of Citywide Health Insurance Access, as stated earlier. And I'm going to keep this is a brief overview presentation, again, being respectful of people's time. So if in the future you want something a little more in depth, we're capable of doing that. And also, if you know any other organizations, please let us know. My whole life is outreach, and I can't wait for in-person. Okay, let me tell you a little bit about OCHIA is located at the Human Resources Administration, or also known as the Department of Social Services, and HRA helps approximately 3 million New Yorkers with a variety of services. On the left-hand side of your screen, you're going to see core benefit programs they have: cash assistance, employment services, supplemental nutrition, medical insurance, as well, OCHIA falls, child support, and homeless prevention. On the right of your screen, you're going to see some other assistance that we have: immigrant services, IDNYC, HIV/AIDS Service Administration, which is HACA, home care, adult protective services, domestic violence, emergency food, home energy. I encourage everyone to always look and see, because I'm a resource person and you never know. You may not think you're eligible, but you may be eligible for it. The Office of Citywide Health Insurance Access works to connect New York City residents and small business owners to healthcare coverage. And we do this by outreach and workshops and education such as this about public and private health insurance. We have a broad network of partners. We also have a website, which is the New York City Health Insurance Link, but it's also an initiative to connect people under 65 to medical insurance, health insurance coverage at select city agencies. So the Department of Corrections has what we have called facilitated enrollers, when people are being re-entered, to connect to make sure that they are eligible for certain services, make it easy for them to access. What I'm going to talk about today is the facilitated enrollment program for the age, blind, and disabled. And it's also important to note that the work that we do at OCHIA is backed by policy research and a lot of analysis. Uh-oh, I'm stuck. Why won't my slide go?
Do you want to try to stop sharing and then reshare, Dawn?
Yeah, let's see if that works. See, I knew everything was going too smooth. Oh, it won't even let me get to the shared screen. I'm just completely frozen. Wait, let's try. Let's try again. Okay.
Dawn, I will share and then you can talk.
Okay.
Because I have the presentation up, just to be safe. Okay. Can you all see it?
Yes.
Okay.
Although we can see it with the next slide available.
Okay, so let me switch this
Yeah.
up. I
Full
got it.
screen.
Yeah.
Perfect.
Yes. That's good.
Yes. Thank you so
Okay.
much.
So Dawn, you were here?
Right after, next slide after this.
Okay.
Okay. So who's the age, visually impaired, and people with disabilities? So age would be anybody 65 or older. Visually impaired is anybody certified blind by the New York State Commission for the Blind. And people with disabilities would be certified by Social Security, State Medicaid Disability Team, or our New York City only Medicaid Disability Review Team. Next slide. Audrey, are you stuck too? No. Okay. So here are some of the options for the age, blind, and disabled. So you'd have Medicaid, which includes institutional care, nursing home care, or chronic care. Medicaid buy-in for people with working people with disabilities, a Medicaid excess income program, Medicare, and Medicare savings program. Next. Medicaid eligibility, there is required documentation. You have residency, identity, income, and resources, which during COVID, you can still attest to. However, you must prove your citizenship and immigration status. Next slide. So, income and resources for Medicaid eligibility. As we all know, you can't be rich and be on Medicaid. So, a single person is $934 a month, $11,208 per year. A couple is $1,367 with $16,404 per year. You can have resources as a single person upwards of $16,800, or as a couple, $24,600. If you make more than these amounts, there's another program that I will be discussing, the Medicaid excess income program right there. Then the next slide. You can go, Audrey, next slide. The Medicaid excess income program. So it provides Medicaid coverage to individuals that fall into any of these categories. So you can be under 21, 65 or older, certified blind, certified disabled, or pregnant, or a parent of a child under the age of 21. So the amount an individual exceeds Medicaid income eligibility is sometimes called surplus, or I'm sure some of you have heard the term spend down. So what happens is eligible individuals can spend down to the appropriate Medicaid level or provide medical bills for their children or spouse equal or greater to the amount. So I think the best way to describe it, as Audrey has always explained it to me, is that let's say 934 is the income level, maybe you make $1,100 a month. What you can do is you can pay Medicaid that extra per month, or you can show medical bills for that month that you use, or anything relative to show that you've basically spent down and you're not pocketing money. Next slide. The Medicaid buy-in for working people with disabilities, an excellent program. It really helps working individuals with disabilities have Medicaid and still be making a livable wage. So who's eligible? You're between 16 and 64 years old. You have to be employed and you have to be receiving some kind of wages or salaries. You're certified disabled by the Social Security Administration, and you're making anywhere around $2,832 a month as a single person, or as a couple, $3,815. You can have a little bit more in resources as well. If you notice, the single person can have $20,000 and the couple can have $30,000. Next slide. Medicare. Medicare is a federally public health program provided for individuals age 65 or older, with disabilities, people with end-stage renal disease. On the left-hand side of your screen, you see original Medicare, that's public plans. So that's Part A, which is hospital insurance, Part B, which people pay for, and Part D, prescription drugs. On the right-hand side of your screen, you see Medicare Advantage plans, which are private, and I'm sure a lot of people have seen the commercials for them. It's Part C. So it includes your hospital, it includes your medical insurance, it includes prescription, and sometimes it'll have dental or vision. Hospice is covered though specifically through original Medicare. Medicare Advantage plans are specific to areas, so you have to really make sure that you're getting all the information when you're looking at them. Medicare eligibility. So you must be a permanent resident of the United States, a U.S. citizen or a permanent resident living here continuously for 5 years, 65 and older, receiving Social Security disability for at least the last 24 months. There is an exception if you have Lou Gehrig's disease or end-stage renal failure, you don't have to meet the 24-month requirement. It's important to note that Medicare is free for people who have 40 working quarters or greater than 10 years working history. It's also important to take, this is where we always say to people to take a look to make sure you have the 40 quarters. Also check Social Security to make sure all your information is up to date and everything is in order in case you're getting close to apply for Social Security, so you'll know if you're going to have any fees. Because if you do not have 40 working quarters, you are going to pay for Medicare. And you'll see on the right side of your screen how much that it will cost you. Next slide. So these are your premiums for Part B as of 2020. So if you make up to 91,000, you'll see it's $170.10. As you move up, it goes to 238, 340. The one that's always of interest to me is the last two. There's only a $30 difference if you're make anywhere between 170 and a half million or over a half a million. Next slide. I know, it's interesting. The Medicare Savings Program. So there are, excuse me, I'm just going to move something off. The Medicare Savings Programs are Medicaid administered programs that assist people with limited income for paying for your Medicare premium. So we have several of those. We have the Qualified Medicare Beneficiary Program, the Specified Low Income Medicare Beneficiary Program, and the Qualified Individual Program. Now, with Quimby and SlimB, you can have Medicaid. So to qualify for the Quimby, your income must be below 100% of the federal poverty level. So that would put a person of one about 1,074 and a person of a couple of two about 1,452. The Specified Low Income Medicare Beneficiary Program is similar in nature, and I'm not going to get into it because the next slide will explain that. You cannot have Medicaid and QI1. So you would have to choose between Medicaid helping to pay for your Medicare or the Qualified Individual one. Your income must be at 135% of the federal poverty level, putting your income up to 1,449 or a level family of two at 1,960. There's no resource test for consumers who only want a Medicare savings plan. But if you want Medicaid too, then you're going to have to go through the resource test, which will be requiring certain documents. Next slide. So there are changes coming in the New York State budget. Effective January 2023, there's going to be raises in Medicaid income eligibility for people 65 over and people with disabilities to 138% of the federal poverty level. There's going to be increases to the Medicaid resource limit for people 65 over and with disabilities. And there's going to be raises in the eligibility levels for Medicare savings programs to from 100% to 138% of the federal poverty level. And for QMB, it'll be up to 186% of, or I'm sorry, I said that completely wrong. It's 100 to 138% for QMB and 186% for the qualified one individual. SlimB, the second program you saw on the previous slide, will no longer exist, and everyone will be put into the QMB program. This one is kind of exciting. Effective March 1st, 2023, undocumented immigrants age 65 and older will now be eligible for Medicaid. They will be required to join a mainstream Medicaid managed care plan, but they will be eligible for Medicaid. Next slide. So again, in the interest of time, This is information where you can get in touch with me or Shauna Patrick, who's the Consumer Assistance Coordinator, if you're looking for a longer term, a longer presentation or any resources. You will see a number 347-396-4705. That's for our facilitated enrollers. They're there to help any clients navigate the system if they need any help enrolling, or maybe some questions they have about paperwork. It was in person pre-COVID. We're still doing things virtually, so it's best to call the number, and usually someone will get back to you within 24 or 48 hours. Next slide. So I like to talk about two things. Access HRA is a website that allows you to apply for benefits, SNAP benefits, cash assistance. Also, if you haven't accessed the Fair Fares, it's a program that's not really utilized and should be if you're low income. Drops the MetroCard from $2.75 to $1.35 per ride. Next slide. And because we're in the 21st century, we have an app also to make it even easier. So if you have a Google, on Android, you can download it on Google Play or in the Apple App Store. It's also important if you have, cases, you can upload documents, you look at any of your details. It's a good way to keep up to make sure you're always one step ahead. Next slide. So we have some slides with some resources. I did send them to Carla, so you have access to them. I encourage everybody to take a look at them. Again, if you have any questions, I will put my email in the chat room and you can email me directly. We also have a quarterly newsletter. If possible, I'd like to be able to send you guys, or maybe now we also have 2 YouTube videos, and I was wondering if maybe we could link that to the YouTube channel. They talk about an overview of the Medicaid program and the Medicare program and how people can access it. I mean, that's something we can talk about after. But next slide. Some more resources, again, that we encourage everybody to access in this day and age. It's important to know your information. Next slide. And this is some COVID-19 updates. Things keep changing, keep getting pushed back. So it's important to make sure that you're staying aware of how things are working, even though we are going up and down with rates of COVID. I think that's the last. Oh, next slide is thank you and questions, I think. Yes. If you have any questions, please feel free to ask me or Audrey, who's actually been with the program since its inception 2 decades ago. And thank you very much for having me.
Awesome. Thank you, Dawn. Thank you, Audrey, also for supporting with the slides and tech. This is really wonderful information, and we'd definitely be interested in seeing if we could link on our YouTube channels, the explainer videos. I think it's very, very valuable. I would also love to welcome you back in the fall to maybe do a refresher as well, so that we can kind of bring more awareness, and hopefully we'll have some more folks on board. So I see this as like just the beginning of a beautiful partnership. I
love that word, partnership. It's my favorite word.
I did want to allow the committee members to ask questions in chat. I know you have to go, so I see your hand up. Please feel free to unmute yourself. Chad, you're still muted if you're trying to unmute yourself.
Yes, hi, good evening. So I just want to thank you for that presentation. I had a question about the Medicaid services. I'm just curious, for anyone who has a developmental disability that receives Medicaid or straight Medicaid, I'm just curious if the proposed changes for 2023 would have any bearing on anyone who gets straight Medicaid, like someone who has autism, ADHD, etc.
So the proposed changes will only be impacted if that person has Medicare and needs to avail themselves of the Medicare Savings Program. And then the other way would be if the person was undocumented, 65 and they wouldn't be. So the changes are specifically geared towards people who have Medicare increasing the resource tests, so, and the income eligibility. So for example, right now, Dawn mentioned to you that the income eligibility is 934. It will be, if it was today's dollars, it would be 1563. Of course, it increases every year, the federal poverty level, so it will be a little bit more than 1563 a month. So that could impact that person, yes.
All right, thank you.
You're most welcome.
Thanks so much, Audrey. Are there any other questions from committee members? Any questions from members of the public? Awesome. Dawn and Audrey, again, thank you so much. We really appreciate your time, and we'll keep this conversation active. I know that we provided the information for the resource fair that we're doing on June 25th, so look forward to seeing folks there, and definitely regrouping in the fall to recap this information.
Ooh, a resource fair. Is that in person or virtual?
It's in person. It's going to be held at Poe Park. And Dawn, I'm sorry, I thought we had sent you the information, but I could be completely blanking and mistaken. So I will make sure that our office staff sends you the information. And if you're able to participate, we'd love to have you there.
Yes, that would be great. Thank you. I would like that very much.
Awesome. Thank you so much. Thank you both.
Have a great night.
Thank you. Thank you. And thank you, Audrey. I see that Stana has joined us from the New York State Department of Health, the New York State Health Marketplace. How are you?
Hello, I'm so sorry. I sincerely apologize for being late and the confusion. There was a whole big long story behind it, but I won't get into it.
No worries, no worries. Apologies on our end. I know our committee meeting moved to accommodate this to be a virtual presentation, so we're being flexible, and really thank you for your time and for joining us tonight.
Thank you for having me.
Awesome. So Stana, do you want me to navigate through the PowerPoint, or do you want to navigate directly?
I can, if you can make me co-presenter, I can share my screen.
Sure, you should be able to do it.
Okay, let's see. Okay, but that's the end. Oh boy. Let me, I'm so sorry.
No worries, no worries. We are flexible.
Let's see. Okay. There. All right, so I will try to get through this quickly so we have a little time for questions. So again, thank you for having me. My name is Stana Nakli. I'm the Regional Director from New York State of Health Small Business Marketplace. And basically, I would like to talk to you about New York State of Health if you're not familiar with it tonight. And if you are familiar, kind of give you some updates that are currently happening. So let's get started. What is New York State of Health and who uses it? So New York State of Health, I hope most of you have heard about by now, but it basically came about as a result of Affordable Care Act that passed in 2013. The Care Act allowed states to kind of decide whether they want to run their own marketplaces for health insurance or not. New York State of Health had decided to build their own, and it is called New York State of Health, and it's run by New York State Department of Health. So the idea behind this is that in the marketplace allows people to shop for health insurance online. You know, consumers are able to come to our website and easily kind of compare health insurance options that are maybe available to them by their zip code side by side, look at the various plan rates, you know, the benefit details that are covered in each plan, then also seek enrollment assistance if they want to enroll They can look at what they may be eligible for, what financial assistance may be eligible, and hopefully eventually enroll in plan that fits their needs. The marketplace is open to everybody that lives in New York State, that is a state resident and is a lawfully present person. So just few enrollment facts. More than 6.5 million New Yorkers have enrolled in coverage through New York State of Health. That basically means 1 in 3 New Yorkers are now enrolled through New York State of Health. So one of the goals of the Affordable Care Act was to kind of try to lower the uninsurance rates, which I think we have, we've made good strides in since 2013. The uninsurance rate then was 10%, and now it's below 5%. So about 1 million of people have gained coverage since the implementation of the law. So it's progress, but we still have pockets of uninsurance that we're trying to tackle. And some of those pockets actually are in the 5 boroughs, specifically in the Bronx, Brooklyn, and Queens area. So we're really trying to get into those boroughs and kind of spread the information, make sure people are aware, what the resources are, and try to get enrolled in coverage if they're not already enrolled. Okay, so what benefits are included in the plans that we have to offer, and is financial assistance available? So as part of the Affordable Care Act, all the plans have required plan benefits that they have to cover. They're called essential health benefits. There are 10 categories of them, and you can see them listed here. I say categories because within these 10 categories, there are subcategories of things that are covered in plans. But it's, it's a really great improvement of what health insurance looks like now versus what it looked like before, where people couldn't really make sense of it. It really made health insurance much more standardized and easily available, easily able to compare plans side by side and kind of really make sense of what is covered and at what level and so on and so forth. Some of the things that, previously weren't easily available, like mental health services or prescription drugs or pediatric dental vision, are now part of the standard packages of plans that must be available in coverage. So I want to really talk briefly about the American Rescue Plan, because that is kind of something that, we're trying to still make sure people are aware of. This is a part of the stimulus package that was signed into a law by President Biden last year. It had many provisions in it, but one of which had to do with health insurance. And, it came about because of COVID-19 and public health emergency situation. And the idea behind it was that it was trying to increase the financial assistance for people so they could afford coverage during that time. So this is still in effect. It started last year. It's in effect till the end of this year. And we're trying to make sure that people are aware of it. Basically, what it does is it increases the tax credit that may be eligible, that people may already have, and or allow people that were previously not eligible for financial assistance to gain some, so they can hopefully maybe get enrolled in coverage and now can afford it. The next slide just gives you like a really quick sort of example of what it means. So for a person that lives in New York City earning $35,000 per year, their tax credits prior to the American Rescue Plan were $359 per month. They now would be $478. So there is an increase there that represents savings. So they would be paying now, instead of $278 for their plan, they would be paying $159 per month per their plan. So it's definite savings. We're just trying to make sure that people kind of look at this and see what is out there for them and what they may be eligible for. So there is lots of information on our website. It's honestly sometimes overwhelming when you look at our website, the amount of resources there, but there are things that I try to kind of highlight for people that, they can take a look at if they are not enrolled already in coverage, that they can browse through without really committing to anything, without, having to go through the application or enroll. They can look at what kind of financial assistance, for example, they may be eligible for. So we have this tool where you can estimate what kind of tax credit you may get as a family. All you would really need to do is put your county number of members in your household, household income, how many adults and how many kids, and then you would be able to get an estimate. It's not a precise number, but an estimate of, oh, okay, my family may be eligible for this kind of a tax credit that would help us pay for health insurance. So it's a really nice tool to utilize. So when and how people can enroll in coverage through New York State of Health. So normally, in general, there is an open enrollment period in the fall, but because of the current situation with COVID-19 and the public health emergency, the open enrollment has been ongoing for a while, and it's still currently extended through to October 2022, and possibly even longer. We are waiting guidance as the time goes from the federal government on this. But what that means is that anyone can come and get enrolled in coverage right now. Even though normally they would have had to done it during the open enrollment in the fall, right now, because of COVID-19, anybody can get enrolled. So it's really a great opportunity if you do not have coverage to try to get access to it. There are plans that we have that have an open enrollment year round, like Medicaid, Child Health Plus, and Essential plans. So if people are eligible for those plans, they can enroll in those during any point during the year. This is just kind of a really recap. The way this works is basically when a consumer is trying to find coverage, they would come to our website, put their information in, and then our system would let them know what plan they may be eligible for. So we would range through, starting from Medicaid through Essential plan, all the way to qualified health plan with a tax credit. And based on that, they would be able to see like how much their premiums would be and so on and so forth. So open enrollment, as I mentioned, for some of these plans is year round, for others would be during the open enrollment period in the fall. But right now, anybody could come and get enrolled in coverage at any time until at least October. So the coverage deadlines and how this works. So for example, today is June 7th. We always work on the 15th of the month cutoff deadline. So if I were to enroll in coverage today, I have all the way until June 15th to submit my application, and then my coverage would begin July 1st. If I were to come after June 15th, say June 16th or 17th, then my coverage would begin August 1st, and so on and so forth. So how to enroll? There are various ways a consumer can get enrolled, and we try to kind of make it easy for people to choose. So if you're tech savvy and you're comfortable with computers, you can go on our website, create an account, and get yourself enrolled all by yourself online without anybody's help. You can also call our customer call center. They're open 6 days a week. Assistance is available in all the languages, and they can actually do the entire application for you over the phone. And we also have enrollment assisters that are located in every county of the state, speaking many languages. And we really encourage people to utilize the assisters because they're very educated and they know how health insurance work. They're very helpful, and they can sit with you in person. Now during COVID, it's a little more difficult to sit down, but people are doing it more and more again. And they will actually, gather all your information about your family from you and do the entire application for you. So we really encourage people to utilize these sisters. In fact, almost 80% of everybody that enrolled used an assister, and we have, as you can see here, over 7,500 of them across the entire state. So how can you learn more about New York State of Health? As I said, we have tons of different resources on our website. We have materials in many languages, videos, and we would be happy to provide any of these materials to you if you have an opportunity to, distribute this in your community in various forums. All of this is available in our website in the languages that you choose. Any quantity you wish, you can just let us know and we can supply you with a box of materials to kind of give out. I don't know if you have actually traffic coming on foot, but if you do, or any other opportunity, let us know and we can send you things that you can kind of, send out to your community. This is one of the newest tools that I kind of wanted to just mention. I think it's a really nice tool. It's basically provider health plan lookup tool. So if you were trying to figure out which health plan you want to enroll in by, for example, a doctor that you already work with, or you can use this tool. What it does is it pulls all the information into one spot. So whereas previously you would have to say, go to a various insurance carriers website and look, see what doctors are covered with that insurer. Here you have everything in one spot. So you can search by hospital facilities, doctors, insurance carriers, various criteria. It's very, very handy. And so, should you have use for it, we have it on our website. This is the resource that we have where you can look for assisters. If you already know someone by name, you can look them up here and contact them, or you can search by your zip code or county or language that you might prefer to speak in and find an assister. You'll get a list of assisters as a result, and you can reach out to them and connect with someone to assist you in enrollment. We are on social media, on every social media there is, I think, basically trying to kind of connect with community, allow people to get the most up-to-date information that there is. We spread the word about everything that we know. So if you wish to follow us, these are our social media channels. And last slide, this is our call number for our call center. As I said, they're open 6 days a week in many languages, and our website, should you want to look out some of these resources that I was talking about. And that is it. Does anyone have any questions?
Thanks so much, Sana. That was
Sure.
really comprehensive. Really appreciate it.
It was a lot, I know.
It was, but it's all really great information. So I think you've answered my immediate question, was in terms of like materials and enrollment, how, what does that look like on the ground? And I see that you have materials in many different languages, and also the enrollment navigators and resource navigators that are available over the phone and in person. Sound like that's how you get most of your enrollment. So that's wonderful. I did want to see if any of the committee members present have any questions for Stana. Awesome. Any members of the public have questions for Stana? No, just love. Awesome, Stana. So we do have a resource fair on June 25th. We'd love to have you, a colleague, or at the very least, some of these materials to share.
Yeah, we already signed up for it.
Perfect.
Yes,
Awesome.
you.
Thank you. And we do not have a physical office right now, but once we do, I think that we would love to have some of these materials and collateral available so that folks that come into the office can see. So yeah, we'll be definitely in touch about those, like how we coordinate that once we get set up again.
Anytime, let us know.
Awesome. Well, thank you so
you.
much. We really appreciate you being with us tonight.
Thank you so much for having me.
Thank you. Awesome. So we will move to the next part of our agenda, which is a discussion on our community board needs assessment and budget request. So I will say this process is something that the board and the committees all undertake in the fall. And so we are starting to talk about this now because we want to give folks the opportunity to think about what some of the issues are over the summer. And so that when we resume in the fall, we can really hit the ground running and ensure that we are prioritizing the health areas that need attention in our district in particular, and also submit budget requests for both capital and expense funding that reflect the needs of our communities. So I'm going to drop 2 documents in the chat just so that folks can have and follow along. And again, today we're just going to talk a little bit about the process and some of what we've identified as needs in the past. And then this is really just meant to get folks thinking about this over the summer and acquainted so that we can do this work in the fall. So I will start with, 1 second here. So our community district needs assessment. So again, each year, the community board and every community board, all 59 across the city, do this exercise. We're asked to identify the 3 most pressing issues overall for our community, and then within our respective areas, also identify which are the priorities. So in terms of what are the 3 most pressing issues that face your district, we usually talk about affordable housing. We usually talk about education and schools. And then there have been some traffic issues identified in the past and quality of life issues identified in the past as well. So, you know, as the Health and Human Services Committee, I think it's really important that we always prioritize and lift up the health needs of our communities. And so healthcare services is one that I would put forward. You know, senior services, our committee also has involvement with DFTA, the city agency for the Department of for the Aging. So that those might be something that we talk about in the fall as kind of lifting up, but definitely want to leave space for other ideas from folks. So if committee members have questions or thoughts for this one, please feel free to unmute yourself. Okay. And then we go into more specifically policy areas. So Health and Human Services has its own kind of category, and you'll see that there are many different options to prioritize. So that could look like access to healthy food and lifestyle programs, chronic disease prevention and management. The COVID-19 management is a new one. That's not one that I've seen in the past. So good to know that that's there. Mental health and substance abuse treatment and prevention programs and services and facilities for seniors, services for low income and vulnerable New Yorkers. And so we have to choose one of these, which is really tough, and then also give a brief statement on why this is more important than some of the other issues in our communities. And I would say that we could also, you know, say if we do pick, for example, COVID-19 management, hopefully we'll be in a better place by the fall, but we could also talk about, you know, the need for mental health and substance abuse treatment and prevention programs, or, you know, the need for chronic disease prevention and management. So even though we have to pick one, I think we can be more generous in our explanation and response, and certainly flag other issues that we feel are really important to our community. And then you'll see that, again, there are other policy areas. And if you are interested in topics that fall outside of Health and Human Services, I would definitely encourage you to join other committee meetings during the fall to be active in these discussions. So that is the most pressing needs document. I'll switch over to the budget requests reference guide here. And so again, annually, we, the community board, are able to put in requests for city expense funding. So that's general funding and capital funding. So in support of capital projects. And we do this process in the fall and usually wrap up by late November. And so we want to start thinking about what our needs are now. And so this reference guide is really comprehensive, and it is broken out by the policy areas and also the city departments that fall within those areas. And they will identify, like, under the different needs, what kind of budget requests might be possible and whether that's a capital or expense request. So I say this to say, you know, we have to go off of this guide in order to make our selections and submissions for the budget process. For example, if we said we wanted like a community garden, if it doesn't fit into one of these categories, we can't select it. So we have to use this as the guide for what our requests are. Under healthcare and human services, there are quite a few areas. So you'll see that there are needs for healthcare and facilities. We have 2 major facilities in our community board. So that's always something to look at. We have the Department of Health and Mental Hygiene, which spearheads a lot of the different programs that touch the lives of our community board residents. So mental health programs, healthy homes, healthy lifestyles, animal and pest control. There are needs for healthcare and facilities and specific ones for health and hospitals corporations. I'll also say for our hospital partners that are on the line, if there are some facility needs that are coming up that you would want to flag for us and maybe collaborate on a potential letter of support, please reach out to me over the summer and we can start that conversation as well. And then there are the services for older or aging New Yorkers, and that includes those under the Department for the Aging or DFTA. And then also needs for homeless New Yorkers, and the city agency there is the Department for Homeless Services or DHS. And as Dawn mentioned tonight, also the City Human Resources Administration has a lot of programs that we could also put in requests for. So services to support low-income New Yorkers, services for vulnerable New Yorkers, domestic violence services, and assistance for persons living with clinically symptomatic HIV or AIDS. And I saw in the chat, AJ, that you had flagged the importance of PrEP, and I know you have in the past, so that's definitely something we'll keep on our radar. So again, we just wanted to put this on folks' radar now before we adjourn for the summer. When we come back in the fall, we'll have a more comprehensive conversation, and we'll certainly dedicate the bulk of our meeting time to identifying these issues and talking about what needs we want to put forward. I just wanted to give folks a heads up, and for my committee, I will also send this via email. You should have received it from the board staff, but I'll forward again via email. Any questions there? Okay. Awesome, we'll move right along. I'll just bring up the agenda quickly. And so we are now ready for updates from any agencies, hospitals that are on the line with us. So DOHMH, Kenneth, if you're still with us and have any updates, please feel free to unmute yourself.
Hey, Michelle. Good evening, everyone.
Good evening.
So just a few updates. So I know, obviously we all know that we're still in high COVID alert level. There is a little bit of evidence to suggest that we may be reaching like a relative peak. It's a little tricky after holidays because there's a delay in the data, and usually people see each other. So, we would expect it to go up a little bit. So cautious optimism. If we at the moment, our hospitalizations are at 2.10 per 100,000 people. If it goes below 10, we will be at the lower alert level. So that's also good news. With the Omicron variant, we are seeing less severe illness. So hopefully that trend continues. In other news, we hope that in the next, I don't have an exact timeline, but we hope that in the near future, there will be some approval by the FDA on vaccinations for children under 5. It's all preliminary at the moment, but we're also hopeful for that because hopefully when that happens, you know, there's a big push to take away the mask mandates for children under 5 as well. Obviously, no firm like confirmation on that, but that is something that we're hopeful for moving forward. And I believe that's it. Yeah, not a whole lot to report on. You know, still encouraging people to get vaccinated and boosted, and want people to be aware of the alert levels. So that's all for me. Thanks, Michelle.
Thanks so much, Kenneth. We appreciate these updates and hope that the COVID surge certainly continues to decline, and we will absolutely would love to hear more updates in the fall. Hopefully we're in a different place.
Absolutely. Fingers crossed.
Yeah, thank you. Do we have anyone from Montefiore on the line? So also wanted to note for folks, the board met with the district manager, myself, and our community board staff met with Montefiore a few weeks ago and talked about holding a Montefiore 101 sometime in June or the early summer for board members and definitely the members of this committee. It would be remote, and it's really to just get reacquainted with all the services that Montefiore has. Their campus is one of the campus that they have in our district is their largest one. And so we thought it would be good to just have everyone on the same page about what services they're offering, especially services that are open and accessible to the community. So we will keep folks posted on the date, but wanted to mention that. North Central, I see Keisha and Alfredo. If you folks have updates, please feel free to share.
Hi, good evening, everyone. Can you hear me?
Yes.
Thank you. Hope I don't sound too muffled. I'm trying to use the cell phone this evening instead of the computer. Just a few updates from North Central Bronx. Kind of piggybacking off of Kenneth, we do have testing and vaccination services available to the community. There's been a bit of a pivot. So New York City Health and Hospitals, every facility was offering vaccines. There are now a few choice facilities offering vaccines. We offer vaccines to any patient who receives primary care services at our facility. So if you have a PCP and you typically get your services, you are eligible for vaccines, you're eligible for boosters. For testing, that remains a service that we offer for everybody, whether you utilize NCB or not. Most recently, we were able to partner with the Department of Health, and we have a vaccine/testing van now parked in front of the facility so that the community has greater access to these services. We do not operate our testing site in a very robust way over the weekend, but the van does. So they help to fill in the gap. And also, again, just piggybacking off of Kenneth's recommendation, if those who are seeking vaccines and you don't have a PCP, then the van becomes your best quick option. And they're there on Kossuth from 8 to 6, and this is 7 days a week. We're pretty happy to have them. We had to partner with them due to some emergency construction in the building. We fixed that very quickly, but the partnership is seamless, and so we'll have them for a couple of weeks with us. Regarding some of our internal services that we wanted to highlight, one was orthopedics. So actually NCB has not been able to offer orthopedics just under a year. Now that we have it back, we have very uncanny access. And I say that because typically most specialties, you have to wait weeks to months. Orthopedics, right now it's only for adults, but it's available in as quick as 3 days. We are slated to start our pediatric and our sports orthopedics early September. And I guess post the summer break from this committee, we hope that one of the first updates we give you is that we are live with those two services. to sort of dovetail off of that, pediatric primary care is a service we're very proud of, and they have been constantly screening and cleaning their schedule, and they have been able to provide brand new appointments within less than 3 days, and even revisit appointments within about, on average, 15 days. So they are really, really aggressive about making sure the kids can get in. They're also sensitive that this is that time of year where folks want to come in and receive their forms for camp or their annuals. This tends to be the height of that season, or you're going to go away for a few months for our international members of the community, and they want to go back to what would be their native homes, but they want that clean bill of health for the children before they leave. You have access with us. For our adult population, a couple things we wanted to just mention and highlight. We have the chronic disease team, which is multidisciplinary. It includes even a nutritionist, endocrinologist, community healthcare worker, RN. Their focus is diabetes and hypertension. As it stands, our current work has us at about a 72.4% hypertensive control, and that's having a reading of 140 over 90 or below. And our A1C diabetic reading, which is 8.0 or below, is at about a 63.5%. That's a little bit of a drop from what we normally do. It actually bumped up for this last month of May, and we look to continue this push. In part, it's this new chronic disease team that has ramped up our services again. So we expect to continue this push. For radiology, it is a service we have been very intentional about growing so that patients continue to have more access. We received yesterday, actually, 2 brand new ultrasound machines for our women's health department. So we're really excited about that. It'll be online and active before the week is out. We are pushing ultrasound services now with these new devices. They will be 24 hours from Monday through Friday, and it'll be 8 to 3 on Saturday and 8 to 8 on Sunday. There is a push before the year is out to create a 24-hour service here. There's also a push to create a 24-hour service in MRI, and we just hired a brand new technologist, which will help to expand our hours during the work week, Monday through Friday. And we're slated to get another technologist, hopefully within the next 30 to 60 days, and continue to expand to the weekend. It is really important that we stay hyper-focused on our women and children, deemed some of our more vulnerable population in the community. One specific demographic, which is our Bengali population, they actually approached our women's health team and have created a reproductive health partnership. And our midwife director, Ms. Wharton, has actually led the push to educate a group that works with an organization known as LAAL, L-A-A-L, which is hyper-focused on Bengali women's health. They have now partnered so that our midwife program is educating the women of this organization on staying healthy and what sort of preventative measures they can do, what sort of services they can take advantage of within the 4 walls of North Central Bronx. This is our first sort of endeavor in trying to give culturally sensitive healthcare services to the population, and we hope that this is the first of many. We plan to expand this kind of educational service. And then most recently, there was a lot of impact we heard from the community in a project that was from the Department of Transit. They were doing some work on Kasuth Avenue, and it impacted folks' access to North Central Bronx. I wanted to report out a lot of internal, external, and supportive assistance through the office of our Bronx Borough President, Ms. Vanessa Gibson. We were able to connect with the Bronx DOT Commissioner so that in the future, we plan this together. There was a lot of miscommunication, and so that patients are not late to their appointments, so that patients are not dropped off far from the facility and have to ambulate in some challenging scenarios with tractors and pavers and all types of equipment in the way, we'll be moving towards, before any project, huddling and likely doing most of our projects in the evening. We also want to be sensitive that the hours in which they work don't impact you, the community members who may be trying to sleep. Right, so we're just trying to find a balance with them where we're not disturbing your peace. We're also not creating traffic jams on Gun Hill, Mishulo, or any of the cross streets, and that patients have consistent access to us. It was very painful. We had a lot of complaints, but the Department of Transit has been really good partners about not doing this in a silo moving forward. And lastly, we will see you on Resource Day on the 25th. And one of the community partners, Reserve Inc., a gentleman by the name of John Sherman, was on the call, I think 2 calls ago, and invited NCB, and we will be there this Saturday, the 11th. There is another health fair, and we are there for the purpose of offering health screenings. That's it for us. Keisha, do you have anything to add?
No, Alfredo, that was extremely thorough and very comprehensive. So no, thank you. Thank you.
Appreciate you.
Thanks so much, Alfredo and Keisha. We really appreciate the full update. It's really great to hear what's going on in the different divisions. So thank you, thank you, thank you. I did want to ask, is there a flyer or any communication that maybe we could share with residents about the change in vaccinations? Or we even just one advertising the services of the van, the testing and vaccinations for all?
Absolutely, Michelle. We can get some information to you before the end of the week.
Perfect, perfect. Thank you. Yeah, I mean, NCB has been such a hub for all of the COVID-19 kind of activity in our community. Everyone says it, board members say it. So we want to make sure that we're informing board members and more importantly, the larger members of our community. So thank you so much. We completely understand the change and appreciate that you all were thoughtful enough to partner to still bring this service to the community.
Anytime, thank you.
Thank you.
For Michelle.
Awesome. And we will be in touch, Alfredo and Keisha, over the summer on our budget requests, but also if there are any other kind of outreach events that we're doing, we will let you know and see what kind of partnership is appropriate.
Excellent. We appreciate it.
Thank you. Want to ask if anyone from DFTA is on the line. Anyone from the Mayor's Office of Immigrant Affairs? Okay, so the only other update that I wanted to mention was related to the Community Health Needs Assessment Survey that our hospitals have been pushing out. And so I believe the committee talked about this a few months ago, but this is part of a process that's mandated by the federal government and also by New York State, where they are collecting information from the community about healthcare needs. And this information is collected, and then each hospital uses this information to develop a community service plan, which outlines kind of the areas of focus that they're going to prioritize over the next 3 years and kind of will be the bigger umbrella for programs and services. And so I know that we have 2 large institutions in our community district, Montefiore and North Central. When we talked about this, we wanted to make sure that you know, folks understood whether you could fill out both or one. And so we talked to Montefiore, and Alfredo and Keisha, if this conflicts any of the information that you have, please let me know. But Montefiore said that folks can fill out either or both, and that's completely fine. This information, again, is just collecting community level data on what the healthcare needs are. So there should not be a conflict. As a matter of fact, they're encouraging folks to complete both of them. And so the one that Montefiore is pushing out and the flyer that I input into the chat is one that's being spearheaded through the Greater New York Hospitals Association Collaborative. And so they are closing their survey at the end of June. Keisha and Alfredo, I don't know if North Central's is still open or if you wanted to add anything there.
I know that we wrapped up our community health news assessment survey. So we actually don't have anything to add at this point.
Okay.
And Michelle, to your point, it was presented to us that the community at large was actually, if they are utilizers of both healthcare systems, to fill out one per, and that the overarching results were really going to be looked at more cumulatively versus it being facility based.
Right.
That is interesting. Okay, well, the latest from Montefiore was that if someone is presented with the opportunity to respond to both surveys, they should be encouraged to do so. Patients don't need to be, community members don't need to be patients of a particular hospital to respond to that hospital's survey. As long as they provide their zip code in the survey, their responses will be counted for the county. So that was the communication that they had shared. So we want to encourage folks to fill it out because these are really great data points for our community to have. I think we know this process won't happen for another 3 years. But, sorry, Keisha, go ahead.
No, I was just agreeing with you. Yeah, for another 3 years.
Yeah, so hopefully if we are all still around and involved, which I'm sure we will be in some capacity, we can have some pre-conversations just to make sure that we're clear on this as we push it out to the community. Awesome. So our next board meeting, as we've been talking about, will actually be in the fall in September. The third Tuesday of September is September 20th. If folks have thoughts about any topics, please feel free to email me and I will be in touch with the Health and Human Services Committee over the summer on some outreach and just kind of ideas for topics to tackle during the fall. If no one else has questions or thoughts, we can adjourn the meeting. Awesome. Thanks so much, everyone. Really appreciate your time. Have a great evening.
Thank you so much. Have a great summer.
Thank
Thank
you.
you. Good night. Have a good summer.
Good night.